Okay, I'm Macy. I'm your nurse today, and I'm going to be doing an abdominal assessment on you. Can you tell me your name and your age?
My name is Noah, and I'm 12.
Okay, so the first thing I'm going to do is I'm going to get eye level with your abdomen, and I'm going to inspect it for scars, striation, and color. And I don't see any visible peristalsis or any visible pulsations. The umbilicus is midline. The next thing I'm going to do is I'm going to listen to your bowel sounds. Okay. The next thing I'm going to do is I'm going to listen to the vascular areas of your abdomen. This is the aortic. These are the renal, iliac crest. I'm listening with the other side. And this is the femoral. Okay. So the next thing I'm going to do is I'm going to percuss these areas, okay? Okay, I'm going to do some palpation. I'm going to start with light palpations and then I'll do a little deeper, okay? So, light palpations. Okay, now some deeper palpations. Do you feel any tenderness?
Mm-mm.
Okay. Tenderness?
Mm-mm.
Okay. Tenderness there?
Mm-mm.
Okay. So the next thing I'm going to do is I'm going to check for some organ swelling. So right here, I'm going to lift your back up a little bit. I'm going to palpate your liver. Okay. Now, next I'm going to do your spleen. Next, I'm going to do your kidneys. Okay, do you feel pressure when I push my hand in or take it off?
Mm-mm.
Okay. What about on this side? Do you feel pressure or pain? What about when I take my hand off? Okay. The next thing I'm going to do is check some points on you. I'm going to look for some certain signs. The first one is called the Murphy's. So I'm going to press down right here. Knee pain or tenderness?
Mm-mm.
Okay, the next one is called the McBurney's test. You feel any pain or tenderness? Okay. This one's Murphy. This one's McBurney. This one's Bloomberg. Okay. So those are to check your gallbladder and your appendix. So the last thing that I'm going to do is I'm going to do an iliopsoas, and I'm going to push down on your knee, and I want you to try to lift your knee up just gently. Okay, good. Okay, again. Okay, and then I want you to sit up right here, and I'm going to check for CVA tenderness. Okay, thank you, Noah. I'm giving a report on a 12-year-old male that came in for an abdominal assessment. First, we started with inspection at eye level. Abdomen was flat. Color was appropriate for race. No scars or stria. Abdomen was symmetrical. Umbilicus was midline. No pulsations or visible peristalsis was present. Then I moved to bowel sounds. They were present in all 4 quadrants. Vascular sounds noted at aortic, renal, iliac, and femoral without any thrills. Assessed with the bell. Did general percussion with resonance and tympany heard. CVA tenderness was negative to light and deep palpation. Unable to palpate liver, spleen, or kidney. Denies tenderness. Specialty test negative Murphy's, negative Bloomberg's, negative McBurney's point, and negative iliopsoas.